Hello, my name is Dr. Justin Eckenrode. I'm a veterinarian with the Carlisle Small Animal Veterinary Clinic, and I'm here to talk today about allergies in dogs. So a couple things we'd like to address by the end of this would be to answer some questions. Hope you're able to learn a little bit more about some of the signs and the symptoms we see, and then also maybe how to treat dog allergies. First question is, how common are they? Allergies in dogs are pretty common. There are different varieties that we will see, anything spanning from food to environmental, what we call atopic dermatitis, which is an inflammation in the skin, as well as flea allergy dermatitis, and sometimes contact dermatitis, when you touch something and cause an irritation. But those are probably the more common ones that we see. With regards to affecting health or issues in the dog, they tend to have a pretty big impact, not only for the pet, but also for the owner themselves. Most of these animals are licking and scratching. Sometimes it can cause issues with GI stuff, so be it vomiting or diarrhea. So there's a lot of different reasons and things that we can physically see that bring distress to the pet. An annoyance is something I think of consistently with that pet that's always licking, making that noise. You're trying to go to bed and they're licking constantly. That's where these usually tend to come more to the forefront. And because this is something that tends to be more chronic, it is something that tends to consistently keep working in the background, and so a lot of times it starts slow and works its way up. So some of the signs, we've already talked a little bit about that, but some of the signs that we typically see with that, again, are itching and scratching, chronic ear infections. Sometimes they're acute and can be moved through, but sometimes they're chronic and they keep moving on. That constant licking, with licking comes red areas, inflamed skin, what we call hot spots, infections, and those become painful depending on how far down along the lines. Rashes, sensitivity, you can't pet your pet anymore. Sometimes lack of sleep. We will see sometimes too where they don't really get comfortable. They're constantly irritated secondary to that. And then there's the more acute ones, which are like allergies would be like to a bee sting, let's say. Facial swelling, swollen lips, puffy around the eyes, red eyes, stuff like that can certainly be part of that too. So next question is how do you diagnose allergies at home? It's hard because there are so many different things that the pets can be allergic to, and we alluded to that earlier, whether it be the food that they're on currently, whether they have a flea allergy, whether it's something that's in the environment, or maybe a new shampoo or a detergent that you're using. We have to use certain clues to figure that out. So a lot of times the conversations that we have in the practice will be questions of duration. So how long has it been going on? When did this start? The age of the pet. Is this something when it started as a puppy and worked its way up and continued to go? Maybe it started off as just a seasonal issue where we'd only see it in the fall and maybe in the spring. And then as we've moved along, addressing it intermittently, now it's become more consistent. So little things like that can help us diagnose. So maybe not a true diagnosis from home, but that information, maybe again back to new changes of like I said, shampoos or things that you've offered, maybe new treats that you've given that you would not know normally. Those are little things that can play a role to help us diagnose down the line. So the next question that comes with that is, how does the veterinarian diagnose? And it's very much on the same thing. I consider the management of allergies very much a team effort, because not only does it take the veterinarian to help us work through the information to get that pulled together, but it also is very much information because I need to give that to you, the client, to be able to take that information. So let me start that over. Diagnosing the allergies at home, as well as diagnosing or veterinarians diagnosing that information, are very much together. I call it a team effort, and that is really the only true way to move past allergies or to manage them better, because do we ever fully cure them? Well, it depends on the cause, right? So let's take flea allergies, for instance. Flea allergy dermatitis is probably one of the more common ones we get. There's a primary, which are your fleas, and secondary, which is usually the trauma, the the irritation to the skin, the dermatitis, the pyoderma, the infection that comes secondary to it, so those hot spots that we call them. You can manage the hot spots as a secondary, be it a topical or antibiotic or something along those lines. But if we don't get rid of the fleas, which are the primary, then it perpetuates it. So with medications that we have, with new products that are out on the market, we can better manage and possibly remove the fleas completely from the environment that they're in, be it inside the house. And by doing that, clean up the skin and therefore cure the pet. And so that has a very good outcome, and a very positive one typically if we can stay consistent with it. Whereas something that, let's say, is environmental, that takes a little more time depending on where you live or what you have, seasons, or how long has it been going on? Is this something that started way back as a puppy and then growing since then? Or is this a new thing? Food allergies can fit along the same pathway, where if it's a new treat or a new ingredient or something that was just introduced, that certainly can be something that we can pull away from the pet, and the signs will go away and we move on. Whereas if it's something within the food that they're eating consistently, we might find where a whole shift or a whole change may be in order, or even just a new routine altogether. We feed this direction, we do this, but now we need to make a full change. So, but it not only just takes the veterinarian's or the veterinarian's direction to get that accomplished, but also the work of the pet owner to really kind of implement and work with that, sometimes very simply, sometimes much more complex. And again, it really boils down to what is the underlying cause, how do we fix the primary or figure out what the primary is, to be able to improve down the line. And again, all of these are really aimed after improving those signs and those symptoms that we see on the front end, to improve the health and well-being of the pet. And so those are the biggest things, because the better the pet feels, the less problems, vomiting, diarrhea, itchy skin, licking, those kind of things, the better quality of life we have for that pet, the more comfortable they are, the happier as clients we tend to, or pet owners we tend to be. So how do dog allergies get treated using these anti-inflammatories? So there are a lot of different things that are on the market. A lot of people reach for antihistamines as a source, because one, they're readily available. You can easily get to them. There are different versions of them. We do have to be careful. We typically do not want the ones with decongestants. So the Claritin Ds, if the world, or something with a D in it, because that can cause secondary issues that we don't want. So antihistamines, what we do know in pets is that a histamine release with regards to allergies is a lower on the totem pole. So a lot of people that I have that come, pet owners that I have that come into the practice, say that we've been giving this medication consistently for the last several months and we think that they're immune to it, or it's not working anymore. Well, we do know now that it plays a very small role in atopic dermatitis or environmental dermatitis in pets. It can be used very well for those bee stings or those acute things, but as far as a long-term maintenance, it doesn't work typically very well. There are other medications that are on the market that will help consistently more target with the itching part. So by doing that, be it steroids or something along those lines, or medications like Atopica or Apoquil, Cytopoint, are really kind of aimed for decreasing that itching, and less trauma to the skin means less dermatitis, pyoderma, so infections and inflammation. And by improving that, then it brings more comfort. Again, not necessarily addressing the primary, but controlling the signs and the symptoms. And sometimes those controlling the signs and symptoms can help us move past that. So take seasonal allergies or atopic dermatitis. If the pet is allergic to something specific that is blooming or coming out at that time, if we can manage it, most of the time we try to be proactive with that. So start these medications earlier in the process, so less trauma to the skin, less treatment of secondary issues. Therefore, we get better improvement on the front end. So the moment we start to see, oh, my pet typically in the month of March starts to scratch or starts to itch or lick their feet, we might start medications now that we know a pattern. And this boils back to how do we diagnose from home and be part of that team. But if we get that information on the front end, we might be able to start medications or treatments ahead of it that are more proactive with managing the primary. And so less itching, less trauma, less irritation to the skin, better quality of life and better improvement for the pet. So again, I can't emphasize how much teamwork really goes into this. to manage that. So steroids are another, and I briefly discussed that, another good option. They're great for acute, but do not have great long-term benefits because of the side effects: drinking, urination, increase in appetite, weight gain, and it can come along with its own skin issues secondary to it. So, and plus long terms with the internal organs. So we really try to manage as best we can. And again, I think there are some better products on the market that are able to manage that better. So that's how we use typically that. Again, aim towards that itching and scratching and improving that to do that. Shampoo, how is that used? I tend to lean a lot more on a topical therapy with concerns growing with antibiotic resistance. And using antibiotics in a way that may be appropriate, but are selecting for problems down the line, especially for things that are chronic and continuation. We try to reach more for topical. It does mean a little more work or a little more effort on the pet owner because bathing the pet more often, especially if they don't like to be bathed, becomes more of a challenge. There are mousses or topical sprays, options that we have that don't always mean we need to stick them in the bathtub or rinse them off outside. Sometimes if they're that itchy or they're that painful or their skin is that bad, I will start them on medications in front of it before we even attempt to put anything topically. This is a perfect classic example for the chronic otitis or ear infections. A lot of times these allergies have been brewing underlying and they're getting worse and worse. And what happens is they build up and then you get this severely inflamed, sometimes one, sometimes both ears that are super painful. And then you try to put a medication in and the pet just won't have it. It is super painful. So many times in those pets, we won't even touch the ears initially. A couple days, we're going to try to use something else, a steroid, something to decrease that inflammation, make those ears feel more comfortable, then try to apply topically. So there are ways that a lot of these are interchangeable to really make, again, the improvement of the treatment, because if we can't treat the pet effectively, then we never cure the underlying process and we never get better, which is why allergies tend to be exceptionally frustrating. So again, back to that, I keep harping back on that or falling back on that, is the teamwork really makes a big improvement in the management. But it is a lot of times, unless it's something focal, it tends to be a long-term management with multiple checkups and follow-ups and making sure that we have the best plan. And what are our expectations? Every expectation from a pet owner is a little different. Some people get irritated when there's just a little bit of licking and stuff, and other people, I watch them during the full exam and they're licking their paws constantly, like, oh, you know, they always do that. We just tell them to stop and we keep moving. So there's always a balance act to that and a little bit of a dance when it comes to treatment and how we approach it and what we're doing. So long story short, with the shampoos and therapy, if I can do that and get that skin back under control and improve the skin, then that will make a difference. The other thing that goes along with shampoo therapy is skin. Very much was taught to me before, and understanding that skin you can touch and you can feel. So by putting topical on it, we can help with a lot of times with an antiseptic direction. So that bacteria, that yeast infection, that secondary stuff that's on top there, we can, and even just bathing them to mechanically rinse things like allergens and pollens can make a big difference. What I tell most of my pet owners is that, you know, for us, every day we take a shower and change our clothes and wash our face and stuff, and we remove mechanically a lot of those allergens and pollens that are out there, whereas pets, we only bathe them once in a while. Could be monthly, could be every 6 months, or maybe when they start to stink, we'll sometimes give them a bath, whereas maybe we should be doing it more often, especially during the seasons when allergies are higher. So something very simple that I have used over the years is to take a paper towel and dampen it down, and then when they come in daily is just wipe their face and down over their body. That mechanical wiping is cheap and typically can be effective to bring their allergy down just enough to take the edge off. So again, a multifactorial way. The other part that shampoos a lot of times will do is hydration of that skin, improve that barrier. So by adding things back in and helping to improve that barrier, because the skin is very much an organ too, And so if we improve that barrier, it keeps those allergens and those irritations from working their way through and stimulating that system. So sometimes with some pets, the management ends up being a weekly generalized bath, just again to remove those allergens and pollens, but also to strengthen that coat. So a lot of the topical things can really make a big difference. And so I have some pets that don't need oral medications, but during allergy season, if we give them a bath, maybe on a weekly basis, enough to keep up with that, it can keep their levels down. Another thing that I use a lot when I talk to patients, and a great thing to help us guide whether we're making improvements or not, is using a 1 to 10 scale. So I try to standardize that a little bit when I talk, but 1 being they don't itch at all, there's no issues, a 10 meaning they are itching constantly, or we have really bad diarrhea, we have secondary stuff that's really bad. And then as we start that treatment, I have the pet owner give me some information, and we settle on a number, and we use that as a tracking system. So as we implement things and we come back for those follow-ups, we come back to that number and say, okay, last time we were a 7 of 10 or 8 of 10. Right now with what we've done so far, we're about a 5 of 10. So where does that fit? Well, we're better, we need to do this. Okay, we're going to tweak this, and then we're going to come back in X amount of time and reassess it. And maybe that time around with these extra treatments and the longer we go, now we're down at a 3. Well, that might be, again, from a 7 to a 3, that might be much more amenable and better quality of life and better improvement, and then we stay there. But then the following year when we come back, well, last year we started at a 7, but we've implemented a few things ahead of time. We actually are starting more at a 5 now, so we're already ahead of the game. So these are some basics to allow us to be able to track this and better improve that and tweak our therapy moving forward. And so that allows us, especially with a multi-doctor practice, when we move across, we say, okay, hey, here's what we had last time, here's where we are this time, so we all can stay on the same page. So that can make a big difference there too. Hyposensitization, desensitization. So there's a lot of discussion about it, because I do have people ask periodically about testing. How do we test for that? So with food allergies, we'll use that in particular. The blood tests and stuff I find not to be very effective. They give you information, but I don't feel like they give you enough to tell you that, hey, we need to avoid this or do that. The best way to do it is to do a food trial. And again, this is back to that teamwork part of it, because in this direction, the hyposensitization is basically trying to figure out, so if we are allergic, and most of the time it's a protein source, but let's just use chicken because it's very abundant. So we're allergic to chicken. Over-the-counter diets tend to have mixtures. Even if it says it's lamb and rice or something along those lines, if they're made in the same factory, let's say that has something that has chicken before that, there's the possibility of particulate matter and stuff getting in there, or little pieces of chicken, the protein itself getting in there. And so because of that, you might still have this underlying allergy. So a lot of times we will reach for these prescription diets to help us with that. And by reaching for those and staying strictly on that, that can allow us to pull out possibly what's causing that allergy. And then of course we have to manage the secondary things. So be it, we manage the GI tract as we need to, some probiotics to get that back to normal, some things to get them over the hump, anti-inflammatories, or whether it's skin, we might need those anti-itch or some topical therapies while we do that treatment. Then from there, as the food goes along, and typically we'll go 6-8 weeks with that, then we can reassess. Ideally, it would be perfect if everything got back to normal, that we would reintroduce that food that we used to be on, so we could figure out, yes, that seems to be the issue. But I have some people that are like, man, we got this dog, our pet so much in a better place that we really don't want to go backwards, and we'd like to just stick with this food. And that's not a bad idea either. We can stick to the diet long term. So there are plenty of options. When it comes to allergies and injections and pill, I think there are options when it comes to pills. Again, efficacy is kind of, I don't have enough information on that specifically, but let me step back. The hyposensitization and desensitization therapy, when it comes to hyposensitization and desensitization, I typically will talk to clients, especially if I think that this is something that's going to be long term. I start pushing a little bit harder in the beginning to talk more about seeking information from a dermatologist. And the reason I recommend that is because they're able to to do more of specific testing. So let's take our seasonal or atopic dermatitis, because typically that means itching and scratching and skin. Because you can see it, you can do it. You can run the allergy testing specifically on the skin and find out what that pet is allergic to. From there, they can put together, because you're actually looking at the organ or the issue that's having a problem, and pinpoint what they're allergic to, put that into an allergy injection, and then you start with trying to get their body to not react as badly to the allergen of choice. So, again, if let's ragweed, something that they're maybe allergic to, if we can use small amounts of that to get the body to not have such a big reaction to it, perhaps we can get them better under control. But because of the uniqueness and the little direction, I typically will recommend earlier in the process to start thinking about that, because again, this is all about the chronic. So I always tell people it's more about, we're trying to win the war, not the battle. We can fight the battles and we can work through it, but sometimes we need something to look at the bigger picture. If it's something where it's seasonal and short and we can get on and get off, that's where some of the newer medications, the Apoquil and the Cytopoint stuff can come into play, and very helpful for that. So those are things we look at specifically there. I'll come back and let me restate that. Okay, with regards to hyposensitization and desensitization, when it comes to some of those things, what I look at is trying to very much balance the, I lost my train of thought here. So when it comes to hyposensitization and desensitization, a lot of my push or my direction is to try to seek some more information, and typically from a dermatologist when it comes to that. And the reason being is that if we can get that concoction, if you will, or that allergy serum dialed in to what they're allergic to, probably and most effectively by doing it with skin testing, then we stand a better possible outcome, because we're fighting fire with fire. We're trying to use what they're allergic to help desensitize to them by giving them small injections of that and getting their body not to react as fully, and therefore bringing that down and improving that. So typically the longer those go, if I think it's going to be a long-term, or again, something that I think is going to be a much bigger issue, then we might start seeking that information from a dermatologist a little earlier in the process, or have people start thinking down that direction, or start having people think down that direction to see whether we need to move forward with that. So that's an option there that I will look at sometimes, again, depending on what we've got, because some of these are very easy to manage, and some of them are much more difficult. So it just really depends on the cause and the direction for that. So just to kind of summarize, allergies, several different causes of it, depending on what you've got. The food allergies and flea allergies and environmental and contact allergies are probably the biggest ones that we look at. Emphasizing back again on teamwork really being at the core of this. It truly takes a village sometimes to manage these guys, be it topical therapy, oral therapy, injection therapy. Any of those things can really make a difference on the long term about how we manage these guys. Routine checkups and discussions and follow-ups are going to be very important to know, are we seeing that improvement? Are we getting to where we need to be? And how best do we manage these guys long term? And the biggest thing also being is expectations. What are we looking at? Are we looking just to keep them comfortable? Are we really looking for that, aiming at that cure? And to what level are we looking at specifically there? So I appreciate your time. If you have any questions or if you have any questions regarding possible allergies, or your pet may have something or do it, please feel free to give us a call. We're here to help you out. Again, come with an open mind, and we'll work through it and start work and go and see what direction we need to go. So I appreciate your time. Thanks again.